Awesome. All right. Hi, everybody. Good day. From wherever part of the world you're listening to me from, my name is Izine Asor. I am the host of the HSB podcast series, where we talk about the business of health and what it means to build for any healthcare business. We have a very, very important guest today on this podcast. I mean, my guest just literally spoke at Davos. And so she's not just any guest. She is someone who has a track record of, resilience and building for healthcare systems. And I'm so excited to have the privilege of having her on today's podcast series. And I'm talking about no other person than Dr. Zanele. Oh my God, Zanele Abraham. I keep saying there's a backstory to this. I keep calling her doctor. Whenever you think about somebody building for health, you always assume that they must be a doctor or they must
Yes.
either have a healthcare background, but that's not the case. And today, I'm looking to learn more about the story of Dr. Zanel and why she chose to even build in healthcare. Today, I'll hand over to Dr. Zanel to just introduce herself briefly to us as we get started on this podcast. So stay tuned, Dr. Zanel. Would
Hello.
like to meet you.
Yes. Thanks for having me. Thanks for
Yeah,
having me. And it's such an honor. And yes, no, I'm not a doctor. Maybe I should go and study for my PhD.
yeah.
But yeah, I would
That
love to
bias.
greet you. Yeah, you and your guests and the people who watch your podcast. So yeah, at Welo, we are in health tech and we based in South Africa. Started operating in 2020 until now. And I think the problem that we are solving or that we are intentionally wanting to solve is the problem of access to healthcare.
Mhm.
Access to healthcare using technology and the human touch because we are in the African continent. And this is a company that's not only in Africa, our main vision is to just solve this problem globally, only for our continent. So we're using Africa as our first base, where we are in South Africa and other neighboring countries in Southern Africa. And yeah, so that's what we're building at Duelo.
Wow. Wow, I thought I was just talking to some doctor that I'm sorry. You guys are saying that I have this bias for healthcare professionals leading health, but that's not the case with doctors and I look forward to digging deep. But she just said something now that really, really struck me. She's not just building for Africa, but she's thinking of building for the globe, and that is very exciting. Whenever I see an African talk about that, I think I'm very excited about that. And maybe we just go deep into the matter. Dr. Zanel, I read your story and I was beyond inspired. How does somebody drop out of university and say, I'm not gonna go to school, I just want to be an entrepreneur and I just want to solve problems? I'm just curious, why did you choose that route? And how have you seen that journey work for you? Yeah, and maybe most importantly, why did you choose to build in healthcare?
Yes, so I'll start with the journey first. I think entrepreneurs is either it's a calling or it's something that maybe you study for and life throws you at it at
Mm-hmm.
that path. So with me it was a calling.
Mm-hmm.
I've always knew that I wanted to be an entrepreneur. I tried the academic path as I went to university for the first 2 years, and then I dropped out because I was spending lots of my like a lot of my free time, attending or gate crashing entrepreneur events, workshops, etc. And then I asked my mom for permission to just come back home and try this entrepreneurship thing, open my own business. And if it doesn't pan out, I would always go back to university and complete my degree. And then the rest is history. My mom gave me permission, went home, started in construction,
Wow.
male dominated industry, and the rest was history. I never went back to university. Hence, I say it's either a calling or it's something that you do it like later in life. For me, it was a calling. This is something that I will always be doing, even if I was not building Welo. Then Welo came about when we were in the throes of what is it? COVID. During
The
COVID,
pandemic.
is the pandemic and people didn't have access to their medication. And that's when Welo started. I was like, okay, we can use tech because tech is an enabler. We can use tech to give people access to medication, go and collect medication for them, and just deliver it at their home using the Uber model, which is asset light. You don't have to own any scooters or bicycles. You just get people who have scooters, you collect the medication, you drop it for your clients. And that's one thing I want to talk about, to say about tech, is that people mustn't think that this industry is all about rockets and things that are so far. You can use it, you can use tech to solve issues or problems in your area, in your community, in your continent, and problems that we experience daily. I don't know about Nigeria and other countries. In South Africa, most people, like majority of our people, use public health care. And if it's your turn to go and collect your medication, you know that you have to be queuing from 5 a.m. You only going home late at about 2 p.m. So your whole day is spent there waiting to collect your medication because it's government medication, it's free medication. You have to go and wait. So that was what I was solving. Say, hey, I'll go and collect for you. If it's you as
Wow.
Zanele, you're working at your local shop, right, or retailer, if it's your turn to go and collect your medication, it's no work, no
Wow.
pay.
Wow.
And I was like, okay, you don't have to skip work and not get paid. We'll go and collect. When you come back from work, your medication will be so simple, simple,
My God.
solvable solution. That's how Welo started.
Oh my God, that's a very inspiring. I didn't know that the model in Africa was like that, that you get free medicines and then you get that's very exciting. But beyond that, your story of entrepreneurship, like you said, is a calling, and I really, really do appreciate that fact. Entrepreneurship is either a calling or you are called or you're called. And Dr. Zanel definitely is called into this because tell me why would a woman drop out of college and then go to construction? Like literally you think about many other things, but construction. But I mean, Dr. Zanel, you need to be commended, and I really, really do appreciate that story and you sharing that perspective. But the fact that you, beyond even just construction, you still went for hard things. I think this morning I was telling myself it was 3 a.m. I was waking up, I had to confess myself, say, isn't it? That's the hard thing about doing hard things. You have to actually like get up and get the hard things done, even if it was not convenient, even if I still wanted to sleep on my bed. I need to get up because you literally had to from one hard thing, which is construction, to another hard thing, solving for healthcare. Because I feel like anybody who is literally solving a solution in healthcare is actually doing something really hard. And I
It
really
is.
commend how you've been able to solve this problem. And COVID-19 obviously has brought to spotlight how, there's been a lot of gaps in healthcare access. And I love the fact that you mentioned that you decided to bridge the gap to access in healthcare in South Africa and beyond. But Dr. Zanel, can you maybe a little bit dive into the market in South Africa? Can you like just give us a snapshot of what healthcare looks like in South Africa on a day-to-day basis in your market?
Is Zanele, not Dr.
Oh
Zanele.
my God. Please just permit me. I'm giving you the doctor because anybody who is solving
Yeah, no,
healthcare is a
let
doctor.
me take it. So, so the healthcare space in South Africa, and I would say Southern Africa, I think it's just like in other parts of the world, and that's the reason now where now Welo is now pivoting or going towards the direction of saying, now that we've done services and all of that, now that we've been in this industry for since 2020, managing the services and the tech, now we're building a whole tech platform infrastructure, healthcare infrastructure that now is saying, how do we unlock health data? How do we unlock
Mm,
access to health?
yeah,
So the ecosystem or how it is in South Africa is the same as everywhere in the world. If you don't have money or you don't have resources, or if you are staying in like everything is zip code related. Where you were born or the zip code that you are will
yeah.
tell you whether you will get access to
Access
health
to
or
health.
you'll get it quickly. So
Yeah,
be it whether you are in the US, you are somewhere in Europe, you are in Nigeria, you are in
true.
South Africa. So now what we are building and what my competitors, we have brilliant competitors in this space, from South Africa, Nigeria, Kenya, etc. What we are all trying to build is say, how do we bridge that gap so
Yeah.
that your zip code doesn't determine
I mean,
when you get help, how fast you get help, how you get access, or whether you live or die. So I think it's not only a South African issue, it's a global issue when it comes to healthcare. And healthcare has become so expensive. And what we are trying to do, including the competitors, to say how can we come up with innovative ways to get people access to health faster but cost effectively as well. And because it's such a huge elephant, such a big industry. You can't say we're servicing everyone. So with us at Welo, we were like, we are focusing on the target market that we started with, which is your blue collar workers. So if there's a company or a factory or a Dangote refinery, anything from 100 employees and above, we come in and say, you as the factory owner or you as the company owner, CEO, etc., we know that also you cannot afford medical health care or health for your 1,000 employees, etc. These are the solutions that we come through so that we become your healthcare partner for your blue collar employees. Because if they are healthy, they don't become absent. We help reduce absenteeism that is caused by chronic illnesses, by people being unhealthy or people having to collect their medication. It also adds to your bottom line as the company owner. So because health is so fragmented and it's a lot of things. That's where we decided to focus to say we focusing on blue collar workers, working with their employers so that their employers subsidize those health services. Blue collar workers, that's our focus. How do we get you healthy as a blue collar worker? And how do we help you as the employer to make sure that your people do not get absent from work due to chronic illnesses or other illnesses? Then it's a win-win for both employer and employee. So that's
Wow.
where we are.
That's actually very inspiring because I've spoken to a number of people on the podcast, and a lot of people are always advised to go for the informal sector. And you're very, I mean, definitely you're somebody who everybody should actually have around because you are daring, and I think that is that is really exciting. The informal blue collar job. Actually, we have a lot more people. I don't know what the insurance coverage looks like in South Africa, but in other part of the countries we have I've had the opportunity to speak to some of the guests and some of the market leaders, the insurance coverage is still very far-fetched. So what's the insurance coverage looking like in South Africa? And before you started building for healthcare in South Africa, what's one thing you wish you knew before you got started?
Yo, I wish I knew how hard it was. I
Oh
wouldn't have
my God.
started because it's regulations and our type of clients, the lead times are long and you have to deal with people. People are an issue. Humans are
Human being.
problematic. So, but that's the good thing is that when you start with passion and drive, and you have this vision, and you're like, no one is gonna tell me anything. I've started this, and you start naive
Mm,
about what's waiting for you out there. But I love it. I love starting with being naive because if you start with everything perfect or seeing all the pitfalls and the disadvantages at one go, you will never start. You will say, oh my gosh, this is too difficult. This is too hard. I'm not starting this. So it's great to go in a bit of naivety and
okay.
yeah, to say, you know what, let me go and try this out. And then you pay your school fees. You fail,
Mm,
you learn, you fail, you learn, you fine tune and you get it. But if you start with the whole roadmap before you will never start in anything, even if it's just a small restaurant, of selling muffins. If you know all the whole things, like, oh, I'm going to struggle with suppliers and this, you never get started. So I think in hindsight, it's a blessing in disguise that I didn't have the whole map outright. That's all. I like to say to people, just start. Just start. Like God says, He's the lamp unto your feet. He'll show you step by step. He won't show you the whole thing, but step by step you start and things will start just dots will start connecting. Yeah.
wow. And I don't know where to start from, but this is beyond inspiring. And you said just start entrepreneurship class 101. We are taking lessons from you. So all my audience, hope you're taking notes. This is entrepreneurship class 101 from somebody who has done it, been there, seen it, tried something that nobody she knew nothing about. Like literally she doesn't have a background in healthcare. I was always having these fears with my some of my audience. Like when I see people who are building for healthcare who don't have a healthcare background, it challenges me because I have more than just a healthcare background. I have a professional background in pharmacy. I still have an MBA focused in health technology and innovation from Johns Hopkins. And I'm like, okay, I have a degree from a diploma from Stanford in AI for hand. I'm like, when I see people like you, and I'm like, isn't it what are you doing with your life? So thank you so much, Dr. Danielle, for challenging me. Just start, literally, just start. The whole dot will connect. But
Don't
I'm
don't
curious.
overthink it. Yes.
Don't overthink it. Thank you so much. I think, how have you been able to galvanize that strength? Because I know you don't have the healthcare background. How did you, because it's a lot, right, to unpack, right? Building for healthcare.
And then you start hiring people with healthcare background, and you start surrounding yourself with people who are more technical than you when it comes to healthcare.
Mm-hmm.
Because remember, you're also dealing with people's lives. You need to make sure that regulatory, you tick the boxes, regulatory wise. You need to make sure that, you are in line with healthcare laws in every country and all of that. Then you start beefing up your team with people like that. So you come with the vision part, they come up with the technical part, and you start building a formidable team. So yeah.
Wow. And guess I must tell you that Dr. Zanel is not, you see, I keep calling her Dr. Zanel. That's the thing. She's not just a woman who is daring. She's actually somebody who has gone by faith. And I think I'm curious to learn some of your biggest lessons in this journey, because also that's something we would really be glad to learn. She just literally spoke at Davos. And I'm like, okay, yeah, like, people listening to her, and just because she chose to start, just because she chose to launch into something very, very, very important and very, very unique area. So, Dr. Zanel, I just have two questions, and then we'll wrap up, almost wrapping up the podcast series. What are your biggest lessons in this journey? You've talked about people, you've talked about, because I know that definitely building for healthcare is one very, very, very tough terrain to start. But you
So
have, done this very well. Okay, go ahead, ma.
first one, or lesson number one, will be on the business side, because I believe that business is very spiritual. So I start with the business side, then go on the spiritual one. So the business one is that don't wait for things to happen. Most people who go into tech, they want to build this shiny app, or I'm waiting for fundraising first, and then after I fundraise, that's when I build the shiny app and all of that. I started getting on taxis, with that it was just a simple WhatsApp chatbot, which was not more than $50 to create, where people will go to WhatsApp, say, please collect my medication. I get the script, I get on a taxi, 5 a.m. in the morning. I would be queuing for my clients, call a scooter driver. So you see all of those things, it's less than $100 if you can just calculate, less than $50, all of those. Call a scooter driver. I have a package for Ezine. I have a package for Zanele Lerato. Please go and deliver. No, there was no VC there. There was no fundraising there. I was just, what is it? I was just validating for myself as well to say, is this working? Will this work? Are there
Needed.
paid clients out there? Are there people who are willing to part with their money?
Okay.
So just start small as you are. That time you are alone, you don't even have money to afford to pay a team and all of that. Start where you are, start small, validate for yourself, and then investment will come to you, I promise you. The first investment that we got was an angel investor at 25,000 USD. Someone reaching out to me on Twitter because I was
Wow.
documenting everything, the 5 a.m. trips to the hospital and all of that, taking with my phone videos and all of that. Hey, I've been seeing, I love what you're building. Here's 25,000 USD. I want to angel invest. And then we got 100,000. You guys, investors will come to you. Just
Mm-hmm.
build something that solves a problem where you
Mm-hmm.
get people, where you get paying clients. And the second, what is be for me, I know I couldn't do it without God. Like
Mm-hmm.
I always say God is the chairperson of Welo. Like every day at 12 p.m., especially this year, I want to go back to the 12 p.m. I don't have meetings. I don't want meetings. Even my secretary knows, my PA knows. That's my strategic meeting with my father, the person that I started the business with when I was getting on the taxis, before I was on global stages, speaking at Davos. Now we're in 6 African countries. There's my
Mm-hmm.
father who's been the lamp unto my feet. Say, okay,
Mm-hmm.
this is my calendar for today. I'll be speaking with Ezin. I'll be doing this.
Mm-hmm.
I have a meeting. Ish, I have a problem with this employee. How do I talk to them without being emotional? How do I do this? And then, okay, I have a problem with this client. They don't want to pay. How do I do it? So that's why at 12 p.m. every day, because he's going to take us all the way to the top. He took us from the
Mm-hmm.
bottom to the top. So God is not only for Sundays and for church, He's for your
Mm-hmm.
everyday, and you are
Wow.
blessed today, You are African, you're building a $1 billion company. These are not simple and easy goals. You are against spiritual forces and all of that. So you
Mhm.
cannot do it alone. And he's the one that gives us wisdom and grace and favor and all of that. So
Wow.
that's for me, that I don't walk alone. Yeah.
Wow, I know they walk alone. Thank you so much. Oh my God, this is beyond inspiring. Thank you for sharing that. I think this will bless someone. Business is spiritual, business is warfare. And you don't do this with just your human wisdom. You have to get a supernatural and higher wisdom. And I really, really appreciate the fact that you called this out and acknowledge God as your partner in your business. Thank you. And I pray that God will take you places and your business will hear more about that voice and more and more and more and more of your business in Jesus' name. Amen.
Thank
And so,
you.
yeah,
Amen.
we're becoming very
Amen.
spiritual. But let's come back to the meat. But thank you so much for sharing that. I think that is very, very important for our guests to hear that you don't just go into the marketplace without a sound
Yes.
backing. So, we're going to just wrap this up because I know you're very a very busy woman, and just to have your time, I don't take it for granted. So I'm about to say Dr. Zanel, but yeah, we're just going to end this quickly with if somebody's coming to South Africa to invest in healthcare, how do you think, what are the biggest challenges and opportunities for them to invest in healthcare in South Africa? And also, if someone is looking to work with you in your business, how do you think they can reach you, or where areas do you think that they can come in?
Okay, so we will be raising our Series A fundraising round later this year, sometimes this year. So if someone is like looking to invest in our startup, but who's in those Series A rounds, they can just send me an email. It's zanele@welo.health. Zanele, Welo.health, and let's see if we are in alignment because we are at that stage where we don't just take checks, we take checks from people who are in alignment with us,
Yeah,
who will
absolutely.
be able to walk the journey with us to our next stage. And if somebody comes here in South Africa, really, the market here in South Africa, it's really ripe.
Mm,
Like I said, it's not only South Africa. I'll always talk for the whole continent to
mm,
say healthcare is a serious need. After energy and food and water, healthcare is right there. It's a
mm,
very serious need. We need it, be it for the corporates, for the blue collars, or for the people at home, which is your B2C market. And there's just a lot of beautiful innovation as far as Kenya, Nigeria, happening in this space, even in South Africa, where young people and just startups are coming to the fore and say, how can we use technology to solve these problems for not only ourselves but for our people and our continent. So the same with South Africa. Great stuff happening in healthcare, from digital health, now AI coming into the fore, from on the pharmacy side, on diagnostics and labs and all of that. So there's so much happening in healthcare and so many problems to be solved. So yeah, people should come through to our country as well and just partner with startups. Lots to be
mm.
done.
Wow, definitely, this is the best time to invest in healthcare in
Yes.
continent. And I think South Africa is one very matured market already that you should begin to look into. It's very, very matured, both in the pharmaceutical and other areas. So thank you for sharing that. And so we'll drop her email on the comment and on this post so that you guys can also reach out. This is the best time to invest in not just a business, but an entrepreneur who I think you need to invest in, and I recommend her for your investment. So please do make sure you reach out to her. She's on LinkedIn, on Twitter, like she said, and also you can reach her via email. So thank you so much, Dr. Zanel. So we're just going to end this quickly because I know you have a lot of things to do today. What are your, because I always end this with my podcast speakers who
Okay.
come on the podcast. If there is a magic wand you have, right, to solve a problem in healthcare. If you had a magic wand to solve a problem in healthcare, what would be that problem you solve for? If
Which
you
problem
spoke
was
with God
it?
and God just told you you can solve something, what would that be? Would it be,
Please,
yeah.
except for waking people from the dead. No, I'm joking. So I think my heart is mostly with the elderly and children. Like if I had a magic wand, I would
Mm,
want for them not to be sick and not for them not to. suffer when it comes to access to healthcare because now we have kids suffering from cancer, and then we don't have enough doctors. We have our elderly suffering from your Alzheimer's, and they don't have enough doctors to give them care, or they don't have access to the best of the best. So if I had a magic wand, really would be for people, especially our poorest of the poor, to have
Mm.
access to dignity and healthcare services.
Wow, that's definitely what it's so childcare and also elderly care. Thank you so
Yes,
much for sharing that. I'm sorry, I know most times people always want to solve health financing, health assets, health data. There's a lot of problems, but you chose to
yes,
go for the vulnerable population, and that's definitely
yes.
what's calling out. Thank you so much. What would be your favorite quote? We always also ask them, what is that quote? Because I know that there'll be times where you feel like I
Coach,
don't want to do
yes,
this,
I have
I
one.
don't want to do
I
this
have one
again.
that
So
I've had
okay.
since high school. It says,
Hmm.
if you can't be captain, don't play. So if you
Hmm.
can't zone in and excel in the field that you've chosen, why are you there? So if you can't be captain, don't play. So that's how what I live
If
by.
you can't be captain, don't play. Is that what you said? If you
Don't
can't,
play.
don't play.
Yeah, if you can't be captain, don't play. So if
Oh
you
my
can't be the
God.
best at what you do, if you can't be the top 1%, why are you doing it? Go to another industry. Why are you wasting time?
Don't play if you can't be the captain. Wow, that's definitely wow. You're definitely an ambitious person. I'm so glad to have you in my corner now, because that's enough to keep you to say I must win in this. I literally and that attitude.
Whatever career you are in, whether you are an entrepreneur, you are an employee, just have that in mind.
And you said you've had this since you were in high school. No wonder, little wonder. Thank you so much, Dr. Zanel. This has been such a very insightful session, and we're just about to close out. Thank you to all our guests. And for me, this has also been a blessing. I'm definitely going to play this over and over to listen to someone who has done work because I want to speak in Davos, and Dr. Zanel, I'm going to tell you when I speak in Davos because you inspired me to dream for that, and I really do appreciate that. Thank you so much to all our audience who have listened into. If you want to reach out to Dr. Zanel, the link to her LinkedIn profile and her email will be on the comments. I think she's somebody definitely worth investing. So if you're an investor and you're watching in watching this, note that she's raising Series A, and you need to reach out to her to see if there's an alignment. Like she said, she's not just collecting paycheck, but she's actually looking more for the alignment. Thank you so much, everyone. This again is the HSB podcast series where we talk about the business of health. Do have a best rest of your day, and stay connected because healthcare is serious business. Thank you so much. Bye.